And Joy, if you would go ahead.
Sure. I'll talk a little bit about just strategic planning. Using a solution-based approach, it is very important, I think, to identify specifically the nature of the problem or what the deficit areas are. This can be accomplished through a variety of methods, from survey tools like the National College Health Assessment or the Healthy Mind Study, or methods even like focus groups. Although without this measure, you can't effectively determine the goals and objectives, and more importantly, the outcome measures of what you hope to accomplish. Each intervention needs to embrace a learning outcome for participants, which really tie to the overall objectives. A review of current literature and resources, such as the Suicide Prevention Resource Center, will assist with understanding regarding student attitudes and perceptions related to access, stigma, and barriers. Evaluation methods will seek to determine if you have met your desired outcomes. Typical measures may include the use of post-test or follow-up surveys or utilization data regarding services, especially if you have a goal to increase help seeking and access to services. This slide looks a little bit at the engaging of gatekeepers and how important that is. And again, a public health approach to supporting positive mental health on campus involves an integrated approach which weaves through the campus. And key stakeholders, including members of the administration, need to have an awareness of services, but not only what the services are, but the scope of services and information as to how to access additional information when they need or want it. General awareness education requires what I call kind of a shotgun approach, involving numerous strategies and consistent messaging. You know, we tend to only hear information when it clicks with our current needs. And based on that need-to-know learning moment, electronic resources tend to be convenient, easy to promote, and very timely. Two newer strategies that we've employed involve the development of short, high-tech videos that mimic the pacing of a movie trailer. The trailers link to a web-based resource site for students. And these short videos are meant to capture attention and spike curiosity to entice a student to go to a site with more comprehensive information. These trailers will be linked to a STRESS website, which provides resource information, a comprehensive listing of warning signs, self-assessments, and tips for approaching and intervening with a friend or a family member. Additionally, the Worrisome Students website is for faculty and staff, and that hosts several video scenarios regarding working with troubled students, with a comprehensive listing of both campus and community resource. This resource allows participants to engage in 3 different scenarios and listen to professionals discussing the issues related to each one with thoughts and suggestions regarding intervention. It's been very useful because faculty and staff can spend 5 minutes or 25 minutes with this resource based on their perception of need or their interest. It also encourages them to return to the website at any time in the future when they need that at-moment type information. More traditional options are also useful, such as mailings, participation in student orientation programs, and also class presentations. So let's talk about the power of screening. Most students who are depressed, anxious, and/or suicidal do not seek out counseling services on their own. It's important to develop systems to allow students to self-identify and to develop systems regarding early intervention, which focus on a public health model of intervention. The college mental health screening program allows students to take online screenings for depression, anxiety, eating disorders, PTSD, and bipolar. And a nice thing about it is that it can be linked to campus resources, which can promote student access to services. Since over half of our student population utilizes our student health services, we are now in our 2nd year of implementing depression screening in primary care. You know, if you think about it, we're missing a wonderful opportunity if we aren't capturing the students who come in for a sore throat but are actually clinically depressed, and all we have paid attention to is the sore throat. The PHQ-2 is a screening tool that allows students to do 2 questions related to depression, and for us, when they check in at the kiosk, the 2 questions pop up on the screen, and if they've answered positively on those 2 questions, then the 9-question survey, or the PHQ-9, is launched with the clinician in the exam room. Primary care staff follow a protocol based on the screening results that allows them to effectively intervene develop a self-management plan for the student, and refer to the counseling service or to case management. Using a public health model, we have screened 90% of the students coming in for primary care and approximately half of our student population. So let's look at some identified challenges to providing mental health services in the college mental health setting, and why the NCDP project, or the National College Depression Project, really seems to make some sense. We know that we have many unidentified students with depression on our campuses. We also know that students often refuse formal counseling or drop out of treatment. Most of our campuses also have a brief model of intervention and even session limits, which may not be conducive to recovery. Many colleges have also a service delivery system that does not lend itself to collaborative care related to referral systems between primary care and counseling. We also know that it's vitally important to tie our services to improving student functioning, academic success, and retention, and that student follow-up and tracking is often difficult in our care delivery systems due to the fact that they are only with us for short periods of time due to semesters or quarters, and they frequently slip away in terms of poor follow-through. So the benefits of a collaborative care model of intervention in college health relate to the development of systems that can work together to create a safety net for the students identified with depression and, even more importantly, suicidal ideation. It's important to systematically use objective measures, not only the baseline to measure the degree of severity of the symptoms, but then to track progress or lack of progress throughout the course of treatment. In the NCD project, not only is the PHQ-9 used to document symptoms, and this is repeated at weeks 4, 8, and 12, but a functioning tool is used to look at outcomes based on the student's changes in functioning. This becomes very important as we talk to administrators regarding our outcomes in terms of how we help students improve their functioning level in order to stay in school and do well academically. This year, we're also screening for important conditions comorbid to depression, like anxiety and high-risk alcohol use. In this slide, you see the two screening questions for the PHQ-2, which relate to the lack of pleasure and also feeling down, depressed, or hopeless. And students come in and either by paper or if you're electronic would take these two screening questions, and if positive, then the next step for the clinician would be the next slide, which really shows the PHQ-9. And this slide illustrates the Patient Health Questionnaire, which is what the PHQ-9 stands for, and it is a symptom checklist. The checklist was developed to make criteria-based diagnoses of depression in the primary care setting and is very effective in monitoring therapeutic response. A diagnosis of major depression is made if at least 5 of the depressive symptom criteria have been present for more than half the days during the last 2 weeks. The PHQ-9 score can range from 0 to 27. Not at all is scored a 0, with increasing scores from several days to nearly every day. So what you see on this slide is really just a partial listing of the main stakeholders or gatekeepers who interact with students and have the capacity to provide early intervention. Many students are very connected to their parents with daily phone, email, social networking contact, and parents often are unaware of how to identify signs of depression, how to intervene effectively, and also how to refer to campus resources. If listservs for parents or email access is available at your campus, there are many options for providing needed education related to awareness, approach, and referral. We've needed to use hard copy newsletters and mailings at our campus, although that's been very effective in terms of getting, again, the education out to parents. But really each of the individuals in these categories have a unique opportunity for observation and intervention, with faculty, staff, and peers or students probably playing a pivotal role in this process. So one of the most exciting options that I have consistently been impressed with is the web-based product from Cognito called At Risk, which uses gaming technology and avatars, which is kind of all the rage right now, to assist faculty and staff to identify students at risk and to develop self-efficacy skills to intervene and effectively refer. This product actually allows the participant to learn common signs of psychological distress and practice through virtual role play, which is very nice if you know how intimidating actual role play can be, and approaching referring students in a convenient manner with options for both individual and small group interventions. Based on the recent research from Chris Bronson and David Drum and others from UT Austin, we know that training faculty and staff is instrumental to early intervention. We also know that only 58% of students who did disclose their suicidal ideation to others were actually told to seek professional help. Additionally, they found that 2/3 of those who disclosed their suicidal thoughts first chose to tell a peer, partner, roommate, or a friend. We are currently in the process of working with Cognito in developing a student product using avatars and similar technology to assist students to identify, intervene, and refer students in distress. And not only are students very likely to be chosen as confidants by their peers, but they also stand to benefit personally from the increased knowledge that gatekeeper training provides.